Today we're going to discuss ambulating patients with tethers. Tethers are any lines or cords that restrict a patient's movements and can cause falls. Our sample patient has some SCDs, a urinary catheter, an IV, oxygen, and a blood pressure cuff. When you have more than 2 tethers, use a helper. Also, use non-skid slippers and a gait belt to help ambulate and to prevent falls. When you begin ambulating, make sure your bed is low and in a locked position. You can also talk to your nurse about limiting tethers, such as saline locking the IV and disconnecting a feeding tube. Make sure you move the Foley to your assistive ambulating device, below the waist level. Make sure you know how many tethers you have before ambulating. Our patient has a saline lock on her IV, a gait belt, and non-skid slippers. If you have a helper, make sure you communicate your plan. Just in case your patient gets tired while walking, make sure you have a wheelchair or a backup plan near the patient. Make sure that once you get them up, you have a dominant hand on the patient at all times and a non-dominant hand on the oxygen. We hope you enjoyed this video and learned a lot how to ambulate a patient with tethers.